Hello, I'm Dr. Edwin Kendrick. I'm a vascular surgeon in Ontario, California. I also serve as president of a healthcare technology company which focuses on improving care access and delivery in often underserved communities. I also serve as chairman of the board of a nonprofit entity which focuses on improving community awareness related to healthcare, as well as supporting careers in healthcare in children from pre-K through the postgraduate training careers. It is a pleasure to be here today to discuss with you atherosclerosis and peripheral arterial disease, as well as ways to reduce risk for heart attacks, strokes, renal failure, risk for amputation, and death. Atherosclerosis is a disease that impacts arteries, or blood vessels that carry oxygen to tissues throughout the body. Within these blood vessels, they can become narrowed due to things like plaque. Plaque may be composed of fatty cells. It may be composed of cells that create clot, and over time, the vessels may harden from this plaque. When this plaque hardens, it can impact blood vessels that allow blood flow to travel to the brain, the heart, the kidney, as well as the legs. We use the term peripheral arterial disease to oftentimes refer to narrowing of the blood vessels in the lower extremities, the legs. In particular, it's suggested that 14 to 20% of the population has peripheral arterial disease. We also know that the older persons become, the higher their risk of developing peripheral arterial disease in the lower extremities. The reason peripheral arterial disease is of significance is many times if we're able to detect the narrowing of the blood vessels in the lower extremities, it is a marker for what may be happening at the level of the heart. Thus, patients with peripheral arterial disease are at greater risk for having heart disease and suffering complications such as heart attacks, as well as having disease in the neck arteries, which may result in a risk of stroke. What we are learning in communities, particularly communities in underserved populations and those of low socioeconomic demographics, is that the rate of peripheral arterial disease we're noticing in communities is often much higher. At some of the health fairs, we are determining that that rate may be up in the 30 to 40% range. Vascular screening in communities are critical. It is one of the earliest ways we have to impact patients' lives by determining the risk for having peripheral arterial disease, which we established is a marker for someone's risk for heart attacks, strokes, kidney disease, and risk for amputation. By detecting the disease sooner in the legs, we can then counsel patients about following up with their providers, as well as talk about risk factor modifications such as medication therapy, diet, and exercise to reduce their risk for heart attacks, strokes, kidney disease, or loss of limb. When we want to screen someone for peripheral arterial disease and or diagnose them, use of a machine like this is commonly used to detect the disease. For instance, we're able to place a blood pressure cuff on a person's arm, their ankles, as well as their toes. We can again listen to the signal, and we can assess the pressure in the arms and compare it to what's happening at the ankles as well as the toes. Based upon this information, we will be able to detect in patients whether they have a risk and or may be diagnosed with peripheral arterial disease based upon their clinical history and the findings on the Doppler exam.